Dr. Ashutosh Raghuvanshi to try and understand that how India is really prepared, God forbid, if there is a spread of the new virus variant. Dr. Raghuvanshi, good morning. Always a pleasure to have you on ET Now. Before I start the show, let me also extend season greetings to you and your team from Team ET Now. Dr. Raghuvanshi, are you now preparing internally that India will have to fight another battle, and this battle could be wave 3 and the new virus variant?
Yes, Nikunj, definitely, till the time the pandemic hasn't completely subsided, hospitals will have to be prepared. And how hospitals are better prepared now is that we can repurpose the areas rather quickly. We have taken care of some of the infrastructure related issues, especially in terms of oxygen capacity. So most of the hospitals now have PSA plant, both in private as public sector as well. So I think the healthcare industry is very well prepared today compared to what it was earlier.
Vanshi, the sheer spread of the virus is very strong, and if one looks at the sheer spread and we add the maths, then while the number of hospitalization cases may be low, but the sheer number will ensure that the bed requirement will be high. Is that a genuine worry?
So definitely, what the experience we had in terms of availability of beds in the last wave, we have to be prepared with the larger capacities. Most hospitals have enhanced capacities now. The temporary hospitals and spaces which were created earlier also have been activated. But as I said earlier, now we know how to repurpose spaces and areas within the hospitals and outside of the hospital much better. We are also much better prepared to serve patients at home or in hotel setting, etc. So with all those, add-ons, I think we should be able to handle the whole situation, and it may not become overwhelming as was happening during the second wave.
Dr. Raghuvanshi, why is that we don't have enough more clarity on whether this is a mild spreader virus, or this is something which could actually evade the entire vaccine? When do you think convincingly we will be able to get that data?
Yeah. So I think that data should come very soon, because now this is becoming a dominant strain in many geographies other than South Africa as well. And that should give the results rather quickly. But early indications are that the vaccines are not so effective on this strain, but the disease is essentially milder and it spreads much faster. So in a way, if all this is true and it is proven to be true, then over a period of time, if this becomes a dominant variant and causes a milder disease, that may be one way of the pandemic sort of dissipating over a period of time.
I have a follow-up question, purely in terms of medical understanding here. As a doctor, not as CEO of Fortis, Darwin's theory is very simple, which is survival of the fittest. The fact that the virus is spreading and it is mutating, what does that tell you about the Darwin's theory?
Yeah, so I'm not necessarily an expert in evolution, but what I can say is that the viruses are known to mutate, and there are virus shifts and there are virus drifts. So what happens is that there are certain subtle changes which happen in viruses over a period of time, and there are certain dramatic shifts which happen or sometimes. The dramatic shifts lead to sometimes if the virus is infective or and is causing disease, then that becomes a prominent thing. Whereas otherwise, the shift is what makes the viruses less potent. And that is the reason why the flu vaccine has to be changed every year, because of the strains keep changing. So this is a normal viral behavior, and I think this has been there ever since the viruses have been there and human beings have been there. So I think the human immune system, along with all other measures we take of protecting ourselves with, say, masks or any other areas like that, vaccination being one, the disease gradually sort of becomes either endemic or becomes at a level where it is more manageable. So I think the same thing is going to happen here as well. We have had pandemics before, and we have had pandemics at a time when our understanding of science wasn't so much better. So there is no reason why we should not be able to control this over a period of time.
Good morning, Dr. Raghuvanshi. I don't want to get into vaccine politics, but the Pfizer says its vaccine is the best against the newest variant and AstraZeneca is not going to work. But, back home, we are seeing so much conversation and questions being asked about the booster shot. Any conversations that have taken place with the government or any heads up that we have? Because the fact is, we need to act on it maybe faster, and the healthcare workers, our frontline workers, will also want that protection.
Absolutely, Nanta. I think you're absolutely right. We need to consider a booster dose for vaccination because the immunity of the vaccine is limited for a certain period of time. And the booster doses would be required for any vaccine of this nature. So my feeling is that should be done sooner than later. But I think the policymakers are considering all the necessary angles, especially the supply side of it. And as you know, that we still have a large number of people who haven't received the second dose in the country. So I think they're trying to balance both of those factors. But you're right that at least the frontline workers, including the healthcare workers, probably it is the time to give the booster dose. We have had certain conversations along with the other industry bodies with policymakers, and they are positively predisposed to the idea, and they are considering an early solution and early direction we should expect on this matter.
And Dr. Raghuvanshi, I'm going to ask this one question to all of our viewers who may be doubly vaccinated and thinking that they have some superpowers, because everything we've been reading also shows that maybe even having the 2 double doses may not save you from the new variant. So think twice, thrice before going for a wedding or a concert or even, just out gallivanting.
Absolutely. And wearing of mask is essential.
Dr. Raghuvanshi, but like they say that we have to learn to live with virus. We have to learn to live with that there is a mutation which has happened and which will continue to happen. You cannot, while it is important to wear a mask, maintain social distancing, life has to go on. Where does one maintain a balance?
Yeah. So I think, their life can go on normally. I think there are certain things which should not be done. Like, for example, travel restrictions should not be there, but people should use their discretion as to what kind of travels they are doing and what precautions they are taking while they are traveling. If people are following the normal distancing, they are using the mask, and they are sort of probably vaccinated, I think that should be enough to protect themselves. It is not necessary to stop the economic activity because that is not going to be a solution. And as I said, the viral behavior is becoming milder as we go further. So we should protect ourselves in whatever way we can. Vaccine, masking, social distancing is must. Social functions can happen. They can happen outdoors where ventilation is good. And those kind of things will also help to normalize things as quickly as possible.
Just to wrap it up, sir, with one final question. I know we've shamelessly extended our appointment with you. I'm going to pick it up from where you left on the vaccine front. You are in favor of getting a booster shot. But just to understand the science behind it, because the initial data is suggesting that this new virus variant essentially is skipping the old vaccine formula of the mix. Then how will a booster shot be effective?
Yeah, so you're right that this may or may not be effective for the new strains. The but there is still Delta is a dominant strain in many, many places. In India, Delta is still the dominant strain prevalent. So definitely if the boosters are given, that will have an impact on that segment of patients, and that will at least make the disease milder, even if it doesn't protect you completely.
Once again, thank you very much for joining us. You've been very kind and generous with your time, and this year, in a sense, is a year which will be remembered. Like they say, khatti meethi yadein. But I'm hoping that, like we've prevailed from the second wave, hopefully this time there will be no third wave.
Thank you, Nikunj. Thank you for having me.